Winston Churchill called it the black dog. Abe Lincoln was so anguished by it, he cried, "I am now the most miserable man living. If what I feel were equally distributed to the whole human family, there would be not one cheerful face on earth." It is mental depression. The anguish and despair the Greeks described as melancholy. Others are calling it the epidemic of the 70s. But despite its epidemic proportions, depression has been shrouded in secrecy, something to hide, a skeleton in the closet associated with guilt and fear and shame. That is, until that July afternoon when Senator Eagleton made it and himself household words.
On 3 occasions in my life, I have voluntarily gone into hospitals as a result of nervous exhaustion and fatigue. And as a younger man, I must say that I drove myself too far. And I pushed myself terribly, terribly hard. Long hours, day and night. And after that campaign was over, I did experience an exhaustion and fatigue.
In the wake of the Eagleton affair, 60 Minutes decided to take a look at mental depression, its causes, its treatment, and a look at some of those who have suffered from it.
Okay.
Thomas Pike, a millionaire industrialist from California, vice chairman of the Fluor Corporation, surrounded by mementos of his days in Washington as Assistant Secretary of Defense under President Eisenhower. Now 63, a grandfather of 14. He still plays tennis several days a week on his private tennis court. When Tom Pike left power behind him in the Pentagon, he says he suffered a psychological descent from the summit. Except for that, Tom Pike seemed to have everything. Still, he went through agonizing depression for 7 long years.
Fear is something that I've never known. I'm not a brave man, I'm a coward, but perhaps I'm not intelligent enough to be frightened at times. I should be, but I've never been afraid of anything. But here was this damnable kind of annoying fear that maybe I was losing my grip, or I was losing my health, or maybe my mind was slipping, or in some way I was suffering some sort of a disintegration that I couldn't understand. I had excellent physical health. There wasn't any medical background on this. And
well, now, wait a minute. Former Assistant Secretary of Defense, President of the Board of Trustees of Stanford, head of a successful company, a millionaire, and then all of a sudden?
That's right. These things started to happen. Now you must understand that this is a gradual onset. It's an insidious thing. But at any rate, this thing went on until I became virtually immobilized. I got to the point where this thing preyed in my mind so, and I was filled with such agonizing fear that I couldn't hardly bring myself to answer the phone for fear to be somebody I'd have to talk to. At home at the office, I would take refuge in sleep. I was as scared to death to have anybody see me, either a personal friend or a business associate. I would get in my car and leave home or the office with no appointment, nobody to see, no place to go, and drive aimlessly and endlessly over these freeways here. I would stop in and go to churches occasionally, not to pray and be pious, but because the church was a refuge. I didn't have to see anybody there. It stretched from the beginning, as I described it, in 1960 until the middle of 1967. Total 7 years, with the depression spells being a minimum of 2 months, an average of about 6 months, and a maximum of 1 year of total, continuing, unrelenting, unremitting depression, 24 hours a day.
Now, wait a minute. Could you do your job under these circumstances?
I put in an appearance. I didn't do much of a job, and that was one of the many things that compounded my difficulty. It compounded my fear and my shame and my sense of unworthiness. I'm not earning my keep here, and I'm letting Stanford down. I'm letting the family down and the family business and my wife and children. So the thing gets a snowball effect.
Pulitzer Prize-winning producer and director Josh Logan. His credits, Broadway hits like South Pacific, Mr. Roberts. Unlike the unremitting depression Tom Pike experienced, Josh Logan was seized twice with bouts of manic depression that led to his hospitalization, once in 1941, again in 1953. In Logan's case, his deep despair was masked by moods of exaggerated elation. He would fly high. In his own words, he lost all censorship. He threw his money away. He was utterly irresponsible. And he was sobered by what he did to others.
It's the way you affect their lives, your wife, your family, your children, your mother, your father, whoever that is worried about you. It's the fact that you might do anything at that time, something wild and strange if you are crossed. Anybody that's in an elation, in a manic state, is happy as long as he gets his own way. But the moment someone refuses or drops a curtain between you and your own way, you fight through it, or you break through, and you might hit someone, you might push someone, you might walk out of the window as I did once and climb along the edge. 6 stories high, just because someone would lock the door for me inside of a hospital. And that's the kind of terribly dangerous thing that might happen.
What is it that can throw men like Josh Logan and Tom Pike into such turmoil? Well, everybody has theories, though nobody really knows. Stress, the pressures of modern living, early childhood experiences, especially loss through death or divorce. Josh Logan's father died when he was only 3 years old, leaving him to a domineering mother. Tom Pike had been a recovered alcoholic for 15 years when his depression hit, and his parents died within a year of one another, the first time that he had encountered death so close. Of course, not everybody gets that depressed. We all feel blue from time to time, down in the dumps, but that mood usually passes in a couple of weeks. But when the blues don't go away, when those feelings of doubt and worthlessness persist and intensify, that is when depression becomes an illness. And it's estimated that between 4 and 8 million Americans suffer from that illness. The young and the old, the mighty and the obscure, men and women. Jeannie Saluka, for instance. She's young and rich and pretty, the daughter of the chairman of the board of the Chemical Bank of New York.
I suddenly was struck with 30. I was turning a corner, and I could no longer identify with young people, and I wasn't old yet, and I had, as I said, everything going for me, and I wasn't happy. And I wondered what I'd do with the rest of my life, being this way, unhappy.
And often, suicide is contemplated.
This doctor had given me a lot of pills, and I found out quite early in the game that pills they were sort of sleeping pills and things, and I just found myself taking more and more pills and getting up less and less, until finally I realized I either had to go all the way or I had to get up out of the hole and help myself.
Did you ever contemplate suicide, Mr. Pike?
Well, as the thing finally got down to its nadir, I felt like a dead man, and I wished I were dead. So hospitalization was arranged. The finest medical and psychiatric help available was secured, and I was treated. And I had all the treatment. I had EST on 2 occasions, and it's
shock therapy.
Right, and that, of course, frightened me like it does everybody that even reads about it. But there's really nothing to that, and if it's used under the best of professional direction and moderately, I'm convinced that this is a good thing.
Did it disorient you, the electric therapy?
Temporarily, yes. Yes, it knocks your memory, and that's the most frightening thing. And even though they tell you all about that your memory is going to be a little fuzzy for a few days to a couple of weeks, even when it happens and you can't remember what you did yesterday or where you were last week, it's an upsetting thing. But I was helped, I think, by those treatments.
How is it, pleasant or unpleasant? Pleasant.
Electric shock. One of the most mysterious, misunderstood, dramatic treatments in modern medicine. Tom Pike had it, so did Josh Logan. So did Tom Eagleton. Nobody thoroughly understands how shock works.
It's a very mild kind of stimulation to the brain, and the fact that at one time a convulsion was produced, or at one time somebody used the word shock, or that at one time patients had to be held down is an unfortunate thing, but then at one time surgery was a very severe thing also. It's actually a very, very mild procedure. It takes about 3 minutes from beginning to end, and it can be done on an outpatient basis.
What is known is that there is always immediate, if only temporary, relief from depression after shock treatments. One's mood is better. So when the patient is suicidal, like this young man whose depression was so debilitating he was forced to drop out of school, psychiatrist Leonard Kammer, author of Up from Depression, doesn't hesitate to use it.
Very good. You're nice and relaxed, Eric. Look at him. Give me a smile. Come on. Okay. Every patient does that.
Reversal to young age, you see.
Eric, you want to sit down in the chair here? There is memory loss with some of the techniques, and with other kinds of techniques, there is no memory loss. But the memory loss, let me say this, lasts for about 3 weeks and clears up in 98 to 99% of the cases.
Or does it? Others are not so sure. Fear there may be permanent loss of memory. They insist that shock is a drastic and only temporary answer to be used as a last resort. A first resort? Lately, more and more doctors have been using antidepressant drugs.
And I take a small quantity of lithium, which is one of the new drugs that have proved to be very successful in many cases, not in every case, as a mood stabilizer.
I've been taking it for 4 years now, and I have neither been up nor down in any of those.
Taking it in what form and what
In
dose?
a capsule. I take 3 a day now, and it's just a little white capsule. So
You take them with meals?
I take them I take them 3 times a day, either just before or just after meals. I think I need to take one now, don't I? Yes, I should take one now.
And it comes, it makes the valleys less deep and the peaks less high?
Yes, but you see, it doesn't sedate you in any way. You feel nothing from it at all. The only thing that you feel is a lack of ups and downs, that's all.
But drugs, Elavil, lithium, Tofranil, don't work on everyone. And half of those who do respond still fall back into another bout with depression. So most psychiatrists insist that for getting to the root of the problem, for achieving self-awareness, there is no substitute for talk, for therapy, hand in hand with medication or shock, as at the National Institute of Mental Health's Depression Research Unit in Bethesda, Maryland. Dr. Fred Goodwin is a psychiatrist at the Institute and head of that unit. I get the impression, Dr. Goodwin, am I wrong, that medical science, as far as you're concerned anyway, has not yet found the cure for depression.
That's right. That's right. And the reason that we haven't found the cure is because we haven't yet uncovered the causes, in the sense that we can point to a specific cause and say that is why this person is depressed. This is why there's so much effort going on in research into brain chemistry now, because obviously the brain is the organ of the mind, and depression must involve some problem in brain chemistry.
So the work goes on at the National Institute and around the country, trying to unravel the unanswered questions about depression. But even if all of us don't get clinically depressed, most of us feel blue, down in the dumps, tense from time to time.
All of us periodically experience these feelings. All of us feel excessively tired. All of us lose interest in our work at times. All of us have difficulty sleeping at times. All of us has fluctuations in our interest in things, in our appetite, in our interest in sex, for example, which is one of the cardinal symptoms of depression, loss of interest in sex. Yes, we do all have these things, but we do not have them lasting in an unremitting fashion for, say, 3 or 4 weeks at a time, and not all together.
Even Richard Nixon described the tensions he felt in the late 40s and afterwards in his book, 6 Crises. In the early 50s, Mr. Nixon was treated for a medical problem by Dr. Arnold Hutschnecker, then a New York internist, now a psychoanalyst. When Richard Nixon used to come and sit in this chair across the table from you, did he ever talk about depression?
We did not talk about depression. This did not come up. I'm not concealing, no. I think the problems, as I can reconstruct them, may have come. There were periods of depression, but he wasn't aware it was depression.
Rereading 6 Crises, he was talking about the Alger Hiss case. And he said, I began to notice the inevitable symptoms of tension. I was mean to live with at home and with my friends. I was quick-tempered with the members of my staff. I lost interest in eating and skipped meals without even being aware of it. Getting to sleep became more and more difficult. Now, all of these things that he himself wrote about sound like the symptoms of incipient depression.
Well, this is a period of, as I said, everyone goes through a depression, depending what you want to get out of life. Is it the marriage? Is it the career? And he has set a high goal for himself. And when you see problems, difficulties, the tension, of course, is so much greater.
The tension of the Alger, his case, must have been considerable on him.
But we did not have drugs at that time. We never discussed depression.
Dr. Hutschnecker, should candidates for high public office, in your estimation, be required to make full public disclosure of their mental health history?
I think they should, because at no time did a president have as much power as an American president. Someone, and I don't know offhand who said it, when you have elections here and select a president, it's a president not only for the United States, it's a president for the world.
I doubt, writes one authority, I doubt that there is a person around who hasn't been touched by depression or seen its ravages strike one of their loved ones. People don't always have a name for it. They sometimes sit idly by, failing to recognize that the misery they experience or see in a friend is a disorder, not a normal response. So psychiatrists tell us not to sit idly by if the blues don't go away, if we continue to take refuge in sleep, if we cannot function at home or on the job, if we continue to feel down in the dumps. They tell us, seek professional help.